Hey everyone, today I'll be talking about ischemic heart diseases, and in this particular part I will be talking about the investigations. Now, how do you approach a patient of ischemic heart disease? Based on the clinical history and examination, if you suspect that the patient is having ischemic heart disease, then the first investigation that you need to do would be an ECG, that is electrocardiogram. In most of the cases, you can make the diagnosis by ECG, and for that, you need to focus on the ST segment. There can be two cases. In the first case, the ST segment can be elevated, and focus on this diagram. What I want you to see is this part, which is the ST segment, and it is elevated from the baseline. Now if you see ST segment elevation, then the next investigation that you need to perform is troponin I. If the levels of troponin I are elevated, then your diagnosis would be ST elevation myocardial infarction. And if the troponin I levels are normal, then in that case your diagnosis would be Prinzmetal angina. Prinzmetal angina is also known as variant angina. Now let us look at the second condition of ECG, wherein when you look at the ST segment, you find that the ST segment is depressed, or there is ST segment depression. And I want you to focus on this diagram. By depression, I'm considering this part, which is the ST segment, and it has gone below the baseline. Again, if you see ST depression, then the next investigation that you will perform in this case will also be a troponin I levels. If you see that the troponin I levels are elevated, then your diagnosis would be non-ST elevation myocardial infarction. And if you see that the troponin levels are normal, then your diagnosis would be unstable angina, which is actually the classical angina. Now, as I have already mentioned that in most of the cases you can make the diagnosis by ECG. If you are not able to make the diagnosis by ECG, then you need to go on for further investigations like 2D echocardiography, and to get a sure shot diagnosis of coronary artery disease, what you need to perform is a coronary angiography. This will give you a sure shot diagnosis of coronary artery disease, which is the etiology for ischemic heart diseases. So this was the overview of investigations in ischemic heart disease. In the subsequent parts, I will be talking about the etiology and the treatment of individual ischemic heart diseases. If you like this video, make sure that you share this video and subscribe to my channel. Thank you.